Yesterday, Alberta officially surpassed the 70% vaccination threshold to trigger Stage 3 of Alberta's Open for Summer plan, with 70.2% of eligible Albertans receiving their first vaccine dose. And that means that on July the 1st, on Canada Day, Alberta's public health measures will be lifted and our lives will get back to normal. That we will not facilitate or accept vaccine passports, and that in fact we regard, I believe that they would in principle contravene the Health Information Act and also possibly the Freedom of Information and Protection of Privacy Act. That is why the government has reluctantly decided to adopt the Restriction Exemption Program, a proof of vaccination program for participation in certain discretionary activities that have a higher risk of viral transmission. I had earlier committed not to introduce proof of vaccination because of concerns I had around privacy rights. But the government's first obligation must be to avoid large numbers of preventable deaths. We must deal with the reality that we are facing. We cannot wish it away.
In some of our historical data, patients admitted for COVID treatment were categorized as being in ICU when the unit they were on, in fact, had been changed back to a non-ICU unit at that time. The adjustments you will see in historical data today now reflect correctly the type of care those patients were provided.
And that we may run out of staffed intensive care beds within the next 10 days. How bad this situation becomes and how long it lasts is now up to each and every one of us.
There's something rotten within Alberta Health Services. The question is, can and should it be fixed? We'll be asking these questions and more over the coming months at fixahs.ca.
Warning, censorship.
Adam Sos here for Rebel News. And prior to COVID-19, many of us likely gave very little thought to Alberta Health Services. We might bemoan hospital wait times or complain about increased taxes, but for most of us that was about the extent of it. With the onset of COVID-19, AHS bureaucrats stepped into the limelight and became unelected leaders to whom seemingly all politicians in the province bent the knee. Shifting statistics, illogical restrictions, and inconsistent enforcement. All of these Orwellian decisions by public health officials went unchallenged. Pastors were arrested and thrown into outbreak-prone jails, all for apparently our safety. COVID-19 gave these otherwise largely shrouded officials access to unprecedented power, but it also put them in the spotlight. As that light shone, the cracks in our healthcare system became more and more apparent to anyone paying attention. While politicians aimed to blame the unvaccinated or anyone else they could identify as a target, the simple reality was that our healthcare system was failing. Had COVID-19 been a more significant pandemic, our system surely would have fallen. But not because of the unvaccinated scapegoats, but because of the categorical failings of Alberta Health Services. In the interest of factual accuracy and balanced reporting, we will be including responses from Alberta Health Services as we make our way through some of the concerns that are plaguing our health system in this province. Alberta Health Services and the Government of Alberta centralized ambulance dispatch services, reducing smaller communities' control over their own ambulances. This often means that the central dispatch will send an ambulance from a small town to respond to an emergency in a major city, often as far as an hour away, leaving the small towns vulnerable should an ambulance be needed. This centralized management, as with all bureaucracies, has led to serious problems when it comes to emergency response times and management, ranging from ambulances being dropped from advanced life support to basic life support, and unanswered 911 calls to ambulances, which are sitting vacant due to staff shortages. If only anyone had warned them that terminating a large portion of your healthcare staff based on vaccination status could result in a healthcare catastrophe. The acting chief of Red Deer Emergency Service said in a Red Deer News Now interview, "As we look this week with a vacancy of 250 plus shifts in the province, we don't have the people for 250 shifts this week in Alberta. We also sit with 150 vacant positions, as in we could hire 150 more people if they were out there, but they're not. So what we've done is failed to manage and failed to grow EMS structure and the system. The following should perhaps be the most alarming part for everyone in the province, particularly the Alberta Health Service officials who have let it get to this point. A red alert is declared when no ambulances are available to respond to emergency calls in a given jurisdiction. In 2018, there were 917 red alerts. In 2019, there were 669. And unbelievably, there were 3,324 in 2020. AHS provided the following response. EMS is continuing to see an increase in emergency calls over the last several months due to several combined factors, including COVID-19, the opioid concerns, and emergency calls related to people returning to regular levels of activity. All call types have increased, and staff illness and fatigue are also contributing to the challenges in the EMS system. Red alerts in Calgary and Edmonton are a concern, even if they last a short amount of time. During a red alert, AHS EMS responds to emergencies by using tactics such as repositioning units from other communities, deferring non-urgent transfers, deploying supervisors, and using single paramedic response units as needed. EMS is offering overtime to staff who are willing. EMS has also brought on additional staff and ambulances and filled 100 paramedic positions across the province.
In some of our historical data, patients admitted for COVID treatment were categorized as being in ICU when the unit they were on, in fact, had been changed back to a non-ICU unit at that time. The adjustments you will see in historical data today now reflect correctly the type of care those patients were provided.
There are 173 baseline general adult intensive care unit beds across Alberta. This number has gone up and down intermittently, with 241 beds in place of mid-January 2022. Shockingly, the number of beds available in 2018 was 207, so it appears that the baseline number of beds has in fact declined with the onset of COVID-19. Carrie Williams of AHS did clarify that additional capacity for COVID-19 is being managed via surge spaces, not baseline increases. Unfortunately, the jarring increase in statistics presented by politicians and complicit media often uses this baseline capacity to promote the concept of a near life and death triage level, despite ICU usage being down overall compared to previous years. In 2018, ICU usage was at 93%, 2019 it was at 92%, in 2020 it was at 86%, and in 2021 it was at 90%. To get an idea for just how bad our healthcare system is failing, we can look at Alabama, which has a population of roughly 4.9 million people. They have 1,531 ICU beds. Alberta, with a comparable population of 4.4 million people, has a baseline ICU availability of 173. This means that Alabama has one ICU bed per 3,200 people, while Alberta has one per 25,000. Alberta Health Services provided the following response. Almost all COVID admissions are handled in general ICUs, which have a normal funded base of 173 beds. This number does not include other specialty ICU beds, including cardiac care ICU, burns ICU, neuro ICU, and pediatric ICU. AHS currently has a total of 392 beds of all those kinds. Nor does it include the surge ICU beds that have been added during all waves of the pandemic. At the peak of the fourth wave, AHS had a total of 376 adult general ICU beds. With all of that said, even with our highest ICU bed count ever, we are still nowhere close to our American counterparts as far as ICU availability, further highlighting just how dramatically problematic healthcare is within this province.
We came to the conclusion today that it was probably inevitable, given the direction of the disease, that we would end up invoking a public health emergency in any event. And so we concluded that it was prudent to do so now, while we are still at the relatively early stages, so that our the managers of AHS and the folks who are coordinating the emergency response know that these authorities are in place.
With ambulance shortages, ICU baseline reductions, and centralization efforts all yielding poor outcomes for Albertans, at the very least one might hope that our purportedly conservative government might at the very least be cutting some of their spending. But this is simply not the case. In fact, since the 2016-2017 fiscal year, annual healthcare spending has increased by an estimated $1.46 billion. In 2013, former Alberta Minister of Health Fred Horn terminated all Alberta Health Services board members for refusing to end their lavish bonuses. But even that didn't quell the innate opulence that permeates executives working in publicly funded healthcare. Despite all of these issues already mentioned and a healthcare system arguably on the brink of collapse and undeniably unsustainable, the Canadian Taxpayers Federation reported that AHS President and CEO Dr. Verna Yu earned $677,785 in total compensation in 2019. As if that wasn't bad enough, the 920 AHS managers topping their pay charts, according to the Canadian Taxpayers Federation, earn an average compensation of $193,000 per year, all while overseeing the dramatic decline of healthcare in Alberta. Alberta Health Services provided an extensive salary breakdown, all of which is publicly available, but stated that they do not use the same metrics employed by the Canadian Taxpayers Federation and could not directly confirm or deny the 920 management positions and the according salary breakdown. They also added that the massive $677,000 compensation information released for Dr. Verna Yu is total compensation earned in the 2019 calendar year. They noted that the 2019 calendar year included extra pay periods, which happens once every 11 years. As an aside, you might find it interesting to know that the first Chief Executive Officer of Alberta Health Services, Stephen Duckett, joined the Grattan Institute in Australia after his time in Alberta. The Grattan Institute is a think tank that helps shape policy conversations, including, of all things, Australia's response to COVID-19, which, in case you have been living under a rock, has been extreme to say the very least.
That's just for a second?
No, we've got a
No, I don't need to cook. What do you? Well, we'll wait for you to finish. Can you explain why you won't stop and talk?
I'm cooking.
I mean, we can wait. We don't mind waiting. Is there any way that you just for a minute, just to take a? I think people are interested in hearing from you, sir.
I'm interested in eating my cookie.
With all this in mind, it seems apparent that Alberta Health Services should not serve as a model for effective healthcare. Well, apparently, the World Economic Forum, the organization chaired by one of the architects of the Great Reset, Klaus Schwab, and which just this week featured Xi Jinping as a keynote speaker at their Davos Agenda 2022 summit, invited Alberta Health Services to join their global coalition for value in healthcare. Since joining on June 26, 2020, we have certainly seen no increased value in healthcare. What we have seen is health bureaucrats getting wealthier, centralization, and a reduction of key services like ambulance care. Despite decrying the Great Reset in December of that same year, the policies and actions of this government and Alberta Health Services have trended even more towards the bureaucratic and authoritarian methodologies of globalists like Schwab and dictators like Xi. AHS stated in defense that as a result of COVID-19, there has been little activity in relation to their membership of this group.
Many of us would very likely prefer privatized healthcare over the current options in this province. But if the system collapses before we're able to transition to a more sustainable system like privatized healthcare, countless people will suffer and many will likely die. So over the coming months, we will poke, prod, and explore Alberta Healthcare Services, leaving no stone unturned as part of our fixahs.ca campaign. If you have information on Alberta Health Services practices or dealings that you think might benefit our investigations, please send those details to tips@rebelnews.com. You can also sign our petition and send an email to Alberta's Health Minister Jason Copping at fixahs.ca. And as always, I want to thank you all so much for tuning in. For Rebel News, I'm Adam Sos. We need your help to fix Alberta Health Services. If you have any information that you think would help our investigation, send it to tips@rebelnews.com. As always, you can go to fixahs.ca to send a message to our health minister and to sign our petition calling for transparency. Once again, that's fixahs.ca.